very busy facility. What's nice about our facility is it's very family oriented. We have a lot of longevity of the staff here. Most of the staff have been here for over 23 years since the building opened. We do a lot of short-term rehabilitation. We have a 30-bed short-term rehab unit. We do 50 admissions and 50 discharges every month. So it's a very busy facility. We've just started a cardiac program. We hired a cardiologist on staff to follow our CHF program, as well as our pulmonary program. Will be starting at the end of April. We also hired a pulmonologist to oversee that. So in junction with Cambridge and the hospital, we're doing a lot of orthopedic patients, cardiac, and pulmonary residents for short-term rehab.
So my mom is going in she's getting her knee replaced. And so how does that work? Because she's going to need rehab.
Hope your mom can come out and tour at any time. What we do have at Cambridge is a very nice pre-book system where mom can come out and tour, feel at ease knowing where she's going for her therapy after her surgery. So what we do is we'll contact the hospital for her. We'll follow her throughout the hospital stay to make sure her surgery went well. And when she gets released from the physician from the hospital, we'll have a bed set all aside for her. So therefore it takes the thinking out of her final stay from the acute care hospital. Our therapist will take the doctor's orders and treat her probably twice a day. If you're looking at your mom's knee surgery, she'll probably get therapy in the morning and therapy in the afternoon, twice a day, until she's healed. Our goal is to make her be able to go back home to her independent living style that you want. We have activities every day of the week, in the morning and the afternoon, some evening events. So it all depends on what your mom's preference is. If she likes bingo, there's bingo probably 3 or 4 times a week here. If she likes sing-alongs, there's sing-alongs 3 times a week. If she likes to read, there's reading groups. If she likes pet therapy, we have pets that come in. All depends what mom wants. We try to accommodate, so therefore her stay is very comfortable with us. Well, here at Cambridge Manor, 25% of my staff have been here for 23 years. Another 25% of my staff have been here for 15 plus years. The longevity of the staff is what makes our facility special. They take each resident aside and treats them individually. With our customer service programs that we have here, we're way above all the rest. We have a lot of our staff members who actually bring their loved ones here, whether it's for short-term rehab or for long-term, which really speaks mountains about Cambridge, because if you allow your loved one to come here for therapy as well as the treatment, and it's a family member, it speaks very, very highly of Cambridge Manor. Before I came to Cambridge, I was an administrator at Milford Health Center in Milford, and prior to that I was at Harbor Hill Care Center in Middletown, working for the same company, National Healthcare. Yes, prior to becoming an administrator, I was in the food service industry. So I was a food service manager for many years before I became an administrator. With that, I enjoy being out on the units with my residents as well as my staff, working as a team. You'll see me many times in the dining rooms, recreation events, actually helping housekeeping and laundry. You never know where you're going to see me, but we work as a team here because we're all in it together for the residents.